Every year in the U.S. alone, 100,000 deaths are attributed to preventable medical error. Healthcare review bodies say a large percentage of these deaths can be blamed on lack of information. More than $1.2 trillion spent on healthcare each year is a waste of money. This includes $210 billion spent on over-testing due to lack of information. Most patients attending a hospital or clinic for the first time must give the doctors attending them their medical history and the results of any recent medical tests. The onus is on the patient to provide the information, and woe betide them if they get any of it wrong. Sysmedic is a new technology that gathers up-to-date information about a patient from different institutions and geographic areas and makes it available to any physician treating them. Whether it is emergency treatment at an ER, test results from the lab, or even details about allergies and sensitivities, all the clinical information is pooled online, helping doctors to get an immediate and detailed picture of a patient on their first meeting. Apart from providing more information, Sysmedic, which acts without a centralized database, can also help health authorities cut costs by reducing the number of repeat tests carried out on a patient. Having this information available reduces the time it takes before a patient is treated and improves the quality of proactive care and diagnosis. If an elderly patient is suffering from heart congestion, for example, and receives lab results that show his sodium levels are low, he is at risk of a heart attack. But these lab results may not make it to the doctor who knows the patient has a heart problem. With Sysmedic, however, the moment the patient hits a point of care, this information will be flagged, and the attending physician will be aware that the patient's life is in danger. Sysmedic can transmit the data stored about patients to other providers using web services or secure email. Patients can also carry their own summary in paper or electronic format. Our system can be linked to back-end web services, including knowledge repositories such as drug dosing and interaction databases. Future grown areas include the opportunity to link with prescription writing applications and help reduce medication errors. Sysmedic supports evidence-based medication and provides systematic analysis of all available evidence in electronic format from an ever-changing, continually updating statistical set. Whether it is standard clinical trial models, publications on medical protocols and their efficacy, demographic and genetic data, and day-to-day in-field observations, Sysmedic allows physicians to balance their experience and training with its evidence-based data, thus providing real-time situational awareness and decision support. With Sysmedic, physicians can perform diagnosis based on comprehensive background healthcare data about their patients received from multiple providers and payer organizations, both public and private, to more effectively choose the relevant course of treatment. Sysmedic leads to increased interoperability among disparate EMR systems, benefiting both large and small healthcare facilities. Big hospitals will be able to use Sysmedic to more efficiently integrate systems, while independent practitioners and small doctors' offices will be able to automate patient records and communicate critical healthcare information about patients to other healthcare providers at very little cost. Physician specialists save time by using Sysmedic. The care record provides an up-to-date treatment history and list of current medications likely to be much more accurate and comprehensive than what patients themselves can recall. Sysmedic compiles information from myriad healthcare services such as the local doctor, acute hospital, pharmacy, optician, dentist, and laboratory, and makes it integrated rather than fragmented. With Sysmedic, the possibilities are endless. From prescribing pharmaceuticals online to providing healthcare professionals with continual professional development via online learning delivered by video on demand and web-based interactive teaching. From telesurgery and teleconsultation that allow the skills of the expert to be scaled beyond the local hospital, to home monitoring that cuts back on the length of hospital stays, simultaneously improving quality of life for patients. For example, alerts could include messages that advise physicians when prescribed medicines might cause an adverse event due to potential drug-drug interaction, drug-food interaction, or patient allergy. By using Sysmedic, health authorities can also flag other information that will help identify epidemics or outbreaks of certain diseases or conditions. In instances such as a viral outbreak, Sysmedic can help connect the dots to speed up preventive measures. Sysmedic looks at distributed information and brings it to one place, flagging information for attention if it seems abnormal. The days of the patient as a passive recipient of care are drawing to a close. With Sysmedic, patients have greater access to their personal health records, which can assist them in making better, more informed healthcare decisions. Your personal information held by different organizations, doctors, pathology labs, insurers, can be brought together in a cohesive record covering your every interaction with the healthcare system. With Sysmedic, you can be directly involved in the determination and administration of your own healthcare. Sysmedic believes that acquiring and implementing secure and effective information technology that spans the patient, ambulatory care, clinic, provider, policymaker, and payer communities should lead to improved quality of care through better informed decision-making at all levels.